Welcome to this episode of NLN Podcast Nursing Edge Unscripted, the scholarship track. I'm your host, Dr. Stephen Palazzo, a member of the editorial board for Nursing Education Perspectives. Nursing Edge Unscripted and our track entitled Scholarship celebrates the published work of select nurse educators from the NLN's official journal, Nursing Education Perspectives, and the NLN Nursing Edge blog. The conversations embrace the author's unique perspectives on teaching, learning innovations, and the implications for nursing program development and enhancement. This episode is on the issue of clinical evaluation of pre-licensure BSN students. We will discuss the author's article, Clinical Evaluation in Pre-Licensure Baccalaureate Nursing Programs, a Qualitative Descriptive Study. The discussion will focus on the unique findings of the author who published the manuscript in the January-February 2022 issue of Nursing Education Perspectives, Volume 43, Issue 1. Our speaker today is Dr. Patsy J. Butts, who is an associate professor at Middle Georgia State University, Department of Nursing. I want to welcome Dr. Butts to the conversation, and I'm going to ask her to briefly summarize her study and her findings and the relevance to the conversation today. Welcome, Dr. Butts.
Thank you. Thank you for having me. So my study, the aim of my study was to provide a current description of what the clinical or nurse educators, how they were going about doing clinical evaluation across the United States. So I set out to try to include faculty from small universities, larger universities, private and state universities. And I was able to get a good sample from all the different regions across the United States. And what I found was that in the past decade, since Dr. Benner released the Transformation of Nursing Education, and the two national surveys that were done on clinical evaluation and assessment of nursing students, that we really haven't made very much progress. Things stay pretty much the same. People are still doing clinical evaluation the same way. And I found that most of the clinical nurse educators that were doing the evaluation did not really understand evaluation, did not have a background in education, and just really kind of winged it, basically, when they were doing evaluation. So it's not surprising that we are still struggling with the competency levels of our students because we just haven't made much ground.
Yeah, I found the article interesting in just the fact that it's discussing the same thing we've been talking about for 20 or 30 years. Exactly. But this seems to be a theme in nursing, right? We revisit things over and over again without making much progress in moving forward. We talk about this in the nursing programs I've been involved in over the years, the inconsistency in the qualitative nature, of course, of the evaluations in the clinical setting. And, you can have two different instructors, of course, evaluating the same student and come to two very different conclusions about the student's success or progress in the program. And so I know we talk about a way of standardizing our clinical tools across the board. And I know many schools look at other schools and kind of mimic some of the things they're doing. But you're right, the nature of clinical evaluation is very qualitative in nature, of course, very subjective in many ways. We're looking at task attainment for the most part. It's difficult sometimes to gauge a student's, as Dr. Benner calls it, the knowing that is the kind of the skill, and the knowing how and the knowing why is that situated practice-based kind of learning that we sometimes have difficulty describing in an evaluation. Mm-hmm. And so that leads me to the question I wanted to ask you. It seems we've been evaluating, like I said, clinical competencies of students in the clinical setting the same way for decades. The skills list with the task accomplishment, the students do their large, cumbersome care plans, usually still written or, now on the computer. Despite research that Dr. Benner has conducted that describes clinical reasoning and situated thinking and action as a more effective way to evaluate student outcomes. I know Dr. Benner has been developing this work to use in a more contextual way. What are your thoughts on this as it relates to your findings in this study?
Well, when I was talking to nurse educators from across the country, it was clear that they did not have a good grasp on how to do evaluation. Or basically, they use their past experiences in nursing school to determine what they should ask the student to do. And some of us have been out of nursing school for quite a long time, and we made leaps and bounds in medicine. So I found that astonishing. There was a lot of autonomy amongst even the educators in their programs. They were able to do whatever they would like to do. They based it on, I had some clinical educators tell me that they base students' evaluation on a ranking system. They would rank their students from strongest to weakest. They did not really have a clear picture of what competency was. So I find it difficult, or not really difficult to understand. I understand why we have not made the grounds toward what Dr. Benner was speaking of, because it's complicated to try to teach that situated thinking in action, because we don't really have any control over what the patient's going to be that day when we take our students into the clinical setting. So it's difficult to actually make sure that we're meeting those types of objectives for a skilled, knowledgeable educator. So when you have someone who is inexperienced, it's very difficult for them to even fathom how to go about doing that.
We're sometimes talking about it, of course, a nursing student who's inexperienced with an inexperienced educator.
Exactly.
And maybe not an inexperienced nurse, right? But an inexperienced educator. So not understanding even how to, look at the student through the lens of a student and where they should be at the place they are in the program. With the new essentials are here, obviously. And I know all of us across the country will be working with implementing those new essentials over the next several years and looking at competency-based evaluation, which is what the essentials are saying. And this is a good opportunity, I think, for us to reimagine how we can evaluate students in the clinical setting. And the clinical setting now includes the virtual setting, right? Not only the simulations in the labs, but the virtual simulations that are now happening mostly because of COVID. They've been there, but we didn't really start working on them and looking at them until COVID. And I know there's a recent article that Dr. Benner sent me, and forgive me, I don't remember the name at the moment, that talked about the value and looking at the success of those virtual simulations and how you can still get to that situated thinking and practice through those virtual simulations, not in the same way, obviously, as having somebody there with you at the side of the bed. But so what are your, as we continue the conversation around the way we evaluate students, what are your thoughts about evaluating them as we're talking about the new essentials and this competency-based type of evaluation you're looking at, which is not looking just at tasks and checking off on a list?
Right. When I was talking to the clinical educators, and we were talking about what was their process of actually doing clinical evaluation, I actually chose to seek out a recruitment of educators that were CCNE accredited, and that, actually in that accreditation, they require the essentials to be part of the overall curriculum, threaded throughout the curriculum. Interesting enough, I believe only one or two educators ever brought up the essentials. So I think we have a lot of work to do. They actually did not really base their evaluation on the essentials of a baccalaureate education that the nurse needs. So we have some work. I think we really need to work on educating our faculty on how to do evaluation first. But I do agree with the simulations. I think that building a more simulation into our programs is going to help us educate our evaluators, but also to ensure our students are meeting those objectives and developing that situated thinking in action. because it gives us a little bit more control over the type of patients and situations that we want our students to actually have practice with. But COVID has also caused some issues with us being in the hospital. Here in the South, we have been fortunate enough to actually be back into the hospital almost from the beginning, but we did have some areas that students can go to. But across the nation, there are many nursing students who have not even been able to get into clinical, really good clinical situations and experiences to help develop that level of competency. And I saw an article recently, it was talking about crisis in competency, and they spoke to our competency levels of new graduate registered nurses had fallen down to about 9% of those that are entering into practice actually being at the level of competency. So we do have some serious work that we need to work on.
You touched on, we've been discussing the lack of clinical nurse educator training. Would you please provide us with your thoughts on how this inconsistency in standardizing our training impacts student success?
Well, I think it really is one of the major keys to student success. For instance, where I am, we have been working on developing ourselves because we really feel like that's a key to helping the student success. And we are working on developing our part-time, our adjunct who do a lot of our clinicals, having an orientation, working on evaluation, making sure they understand the tools. And, the next step is we're going to have to work on inter-rater reliability with our tools that we use. That, like you said before, the evaluators can have inconsistencies evaluating the same student. And I really think that goes back to the fact that they don't understand really evaluation. When I was interviewing the educators, the backgrounds, were from various things. We had master's level nurse practitioners. There were a few that had doctorates in nursing education. Most were doctorates in nursing practice. And we had some PhD prepared educators as well. And most of them did not have any additional coursework in nursing education. So they weren't familiar with curriculum and really objectives and how to meet those objectives and what the clinical tools actually were measuring. And actually, they told me that the tools were afterthoughts. They did not actually relate them to the objectives of the curriculum for their program of clinical objectives. So it's no wonder that the students are not getting we're not getting a clear picture of competency when we are evaluating students. I think that the nursing programs are going to have to develop their own educational training for much of the educators because they're not getting that coursework. It's not part of the program, their curriculum when they're getting their doctorates, to actually have teaching and learning and evaluation, how to do evaluation in their program. So we're going to have to take it upon ourselves, recognize that it is an issue and that it is impacting our student success. Do it ourselves.
Right. And COVID certainly didn't help. It helped expose a lot of this, and it certainly, is a unique situation that we've been through the last 2 years that, has taken away some of the lens we were looking through as far as how we are doing clinical evaluation because of the move towards simulation, virtual simulation, and just, and I think we should be clear here that this is not a personal criticism of any of our clinical partners we are so grateful for and the work they do with our students. It's more about the system in which we design these partnerships and, the lack of, educating new instructors that are coming on to join us. And there's a variety of reasons why that happens, time, money, regional, amount of people available, et cetera, things like that. But it's a huge problem.
With training ourselves. It's very difficult. We can't put our hand our finger on exactly what competency means ourselves. It's difficult. So,
Right.
you know, it's partly, it's a big problem and it's complicated. It's a very, it's the reason why it's been 10 years and we still have made
Right.
little progress.
Exactly.
It's
Exactly.
extremely complicated.
Yes, yes. And you know, my hope is with the new essentials, it's going to be a new direction for us in nursing education and an opportunity for us to be innovative and look at things a little bit differently and come up with some really outside the box type of opportunities here for us to educate our students and evaluate our students in a way that's different than we've been doing in the past. So it'll be interesting to see what programs are coming up with over the next several years to meet the new essentials. And yeah, I'm looking forward to it.
And the next gen comes out. It'll be interesting to see. Maybe
Yes,
that's going to be
yes.
you know, something that helped push us a little bit forward is those next gen exams. We already have our cohorts in that are going to be taking that exam, and we're already having to think ahead. And the best way to tie it all together is clinical. So maybe we'll get a little bit more intentional, and that's going to help, I think.
That's a great point. Well, I want to thank you so much for joining us for this conversation. I really appreciate your time and expertise in sharing your work and broadening our understanding of the work you did, and just, you know, stimulating a conversation around this topic. To our listeners, if you have not had the opportunity to read this work, you can find the manuscript published in Nursing Education Perspectives, Clinical Evaluation and Pre-Licensure Baccalaureate Nursing Programs, a Qualitative Descriptive Study, published in the manuscript in January, February of this year, volume 43, issue number 1. And thank you for joining us. And thank you very much to Dr. Butts.
Thank you.